Welcome back to another episode of TimeOut with the Sports Doctor podcast, where life, sports, and medicine intersects. We are glad that you are part of this growing community where we strive to help you strengthen your mindset, help you grow your assets, and help you achieve whatever level of success that you want for your life. Go to our website at Dr.Derrick, thesportsdoctor.com, where you can find all the latest content, and you can also follow us on our social media channels. Now, let's get into this episode. Welcome back to another episode of Time Out with the Sports Doctor podcast. We have another very exciting guest for you today, Dr. Manju Dawkins, who is a board-certified dermatologist, also a mother, an entrepreneur, and a former D1 athlete. So you check all the boxes, life, sports, and medicine. So very glad to have you here.
Very, very glad to be here. Thanks for having me.
Absolutely. So one thing on the podcast, I always like to hear the backstory because you're the first dermatologist on the show. So I want to talk a little bit more about exactly what is dermatology, because I know people watch TV and they think one thing about dermatology, but there's a lot more to the field. But first, let's just kind of start off with your background as a Division I athlete and how you ended up being a doctor.
Yeah, so I grew up in Maryland outside of DC, and our area, our school, everything was obsessed with basketball. And so I played, but I'm 5'2", although you can't really tell on the screen. So I didn't look like I had a lot of potential, but I just felt like I had to do it. And so I ended up walking on to the team at Columbia University and ended up being captain by my senior year. So it was quite a journey, and definitely one of my most proud, I guess, achievements in life, because it was unexpected. And actually, so on the journey, so while I was at Columbia, my dean there was basically like, you're never going to get into medical school. And I was like, let's see about that. And then, so eventually I was a teacher for a year, actually, in New York City. And then I went to my state school, University of Maryland. So I did get into medical school. And while I was there, my dean there said, well, you're never going to get into dermatology. And I said, well, let's just see about that. And then I did a year of research, because it is super competitive, even more competitive now. And then I did my residency at Albert Einstein in the Bronx. So yeah, that's how I got here.
So you like a challenge, basically.
Turns out, I guess so.
Yeah. So I think it's interesting, and I think that's the beautiful part about learning about people's stories, because we see you, dermatologist, you're like, wow, dermatology, I can never imagine the dermatology. And then you hear at every juncture, someone was telling you this is not going to work out. The fact that you went to Columbia, that already showed you were high in academics, and then you still wanted to play basketball. So I'm pretty sure you could have went to a smaller school or some other school and maybe been on the team, but you said, no, I want to go to Columbia, and you walked on. So just kind of talk about the whole mindset of walking on and what's that's like, trying to make the team and continue to prove yourself each year.
Yeah, it's interesting, because when I look back, I'm like, who was that person? But that person is me. That I am the same person. Yeah. And because it was scary, obviously, right? I wasn't really supposed to be there, but it's the scary things that offer you the greatest growth. And so sometimes things are so scary that all you can do is just put it all out there. And that's just when the gold comes. And so that's exactly what happened. And I just learned so much from the experience, and the hard work, the relationships, the camaraderie that our team, like, I'm still great friends with, of course, everyone from the team, and I'm still involved with the team now. And to see how much the program has grown, because I'll just say right now, repeat Ivy League champions 2 years in a row. And we have 2 players that are going to the WNBA. So it's just been like awesome to see the growth, and awesome to have been a part of it. It's a privilege to have played. And I just would not have changed a thing about that whole experience.
And what do you take away from your college experience and as an athlete that you still apply now to your practice and to being an entrepreneur?
Definitely that we can all do hard things. And sometimes when you have kind of too much going on, or when people think you're, kind of overly challenged, that's actually when you shine. And sometimes it's just about putting your head down, doing the work, kind of ignoring the noise, and just showing up every day. That's it. That's all you can do. And also that the people around you matter, and that when you are a good teammate, your teammates will have your back always. So
yeah, I think that's really good. And you mentioned being told, hey, you're not going to get into med school. Hey, you're not going to get into dermatology. And I think that's a recurring theme. The more you talk to people, someone along the way probably doubted them for one reason or another. And unfortunately, many people will listen to that. I've had people that I've mentored along the way, and I'm like, why did you not apply to med school this year? Or why did you not apply to dental school? Well, my advisor told me that I wasn't ready because X, Y, and Z. And, unfortunately, many times minorities are given that advice more so than the majority. So just kind of talk about that in your situation.
Yeah, I think I have been learning this at every step of the way, but it's really imperative that you listen to yourself, because a lot of people will have opinions, but they don't know you and they don't know what's inside of you. And I think if we all take the time to kind of quiet the mind, the noisy mind, we all know what we're capable of, what we're meant to do, and what we deserve. And so we must take time to listen to that voice, to that inner voice that tells you exactly where you're supposed to be. Like, I just always knew that I was supposed to play basketball, and I always knew I was supposed to go to medical school, you know, and you have to listen to that calling. It's always going to lead you in the right direction. So, and it's not to say that all the people telling you no, it's not that they're malintentioned all the time either. It just, they just don't know. They don't know what's inside of you, but you do.
Sure, sure. And it's hard to measure somebody's determination or the drive to get to a certain place, because for me, I had to reapply a second time. So that person that told me I could not be an orthopedic surgeon was probably right.
Mhm.
However, I didn't choose to listen and I didn't choose to stop. If I had stopped after the first time, they were 100% correct. But sometimes once you start to push the boundaries,
Mhm.
and once you do it once and you succeed, and then you're like, okay, I can do this. I can do hard things, talking about affirmations. And I'm sure being an entrepreneur, you have to wake up many days and say, I can do hard things, and reflect back on some of those small victories. And that's why it's so important to start getting small wins, because sooner or later, you're going to run into a big obstacle, and you have to convince yourself as well as others that you really have what it takes.
Absolutely. Like, yes. And all of that prepared me for where I am today, because it is not easy. And sometimes I wonder, can I do this? But of course we can. Of course we can. And we are here for a reason. And so I have to pursue that. And actually, what you said reminds me of something also, because the people that you surround yourself with also matter. Because there are people who are going to tell you you can't do it, but there are also people who can see the light in you and see your potential. And you do have to surround yourself with people who see the real you. And it reminds me of the fact, because I also didn't get into dermatology the first time around. And you know how it is, you can match into something else, you can scramble into, I could have settled, but my now husband was like, this is the rest of your life you're dealing with. You do what you want to do. Like, and so that was a really important moment of learning, not only like to, believe again, what do you want to do and follow that? And also be careful about the people you surround yourself with. And yeah. So, entrepreneurship, it is a journey. It is hard. And every step along the way, it teaches you something new. And I feel like, especially like this whole idea of ignoring the noise, it's becoming especially important for me to learn again and again and again. And again, to see you have your own vision, and you know that it can be executed. And you just have to stay with that.
Yeah. So, we talk about many times the destination versus the process, right?
Yeah.
So you made it to the destination. You were a dermatologist, you made it on the road, right? You have one of the very comfortable jobs of being a dermatologist. For most people, they say, wow, you're a dermatologist. What could be better than that? However, there was more. You wanted more even after you obtained that. So just kind of talk about what people sometimes perceive as being the destination might just be a stop along the way.
Yeah, that is such a great point. And it's so interesting, because sometimes I wonder also, like, why couldn't I have just stopped there? Why wasn't I happy there? But it just shows you, like, that is being human. Like, it is, striving is within us. Like, we can't help ourselves in some ways. And I just felt like, wow, I just think that I have more to offer. And it's almost like I couldn't stop myself from keeping going, because I just know that this is something that the world can use. And so that's why I can't stop. And yeah, and I think that's also the other thing, especially for physicians, is like kind of keeping our minds open, because we do have this, like, we're kind of really, it trained in us to be like, okay, you are on this track, you get to this station, then you get to the next station, and then you're at and that's it. You just keep going. And that's not really how life is. It can be so much more than that. And I think if we allow ourselves to kind of think more expansively, like, you don't know where life is going to take you. And it's so kind of much more exciting, and you're able to touch so many more people. I think if we can allow ourselves to be more than just the, physician seeing patients that we are kind of told to be. So.
Yeah. And I think one thing about training the physician mind in general is we're used to having a course
Mhm.
or a curriculum, and you
Mhm.
follow that and you get tested and you go on to the next thing, you learn it, you get tested, you keep going. entrepreneurship is not that way, right? you
Yeah.
you come up with this idea, and then the test comes, and then you start to figure it out as you go along. So I think that it's a whole different mindset, and once you can really embrace that and release maybe some of the fear of not being perfect or the fear of failure, which we don't ever want to fail along the way. I was thinking about this earlier as you were talking. We need to do undergrad 4 years, medical school 4 years, residency, start your career, and keep pushing and never take a break, never have a setback. But that's not realistic. And you don't really realize that until I get into med school, and the average age is about 25, 26. I'm like, oh, so me being 22, I'm actually young here, versus I'm thinking that if I didn't get in right away, life is over.
Yep, absolutely. And then I don't know, when I look back and I think on those like failures, or that gives you time a lot of the time, right? Like a space to actually think about what it is you really want to do. Or we all need that. Like let's bring back the sabbatical. You know what I'm saying? Like we all need breaks in life to really figure out whether we are on the right course. It's imperative. And the same thing, like every failure is there for a reason, to teach us something and to take us onto the right path that we're supposed to be on. So I really think, yes, especially for people in healthcare, we need to reframe that whole thing. That train must stop at the stations.
And I know one thing that I've seen you speak about on other platforms is taking time off, right?
Yeah.
And how that's, especially in America, you are learned to just push through. Even if you have a baby, have an illness, give them a little time and get back at it. And that's not something that you can really do for the long term and be physically healthy or even mentally healthy. And I think we're starting to learn more about that.
Yeah. And it's so funny because we are in healthcare and we do not practice what we preach in that way. And I read this beautiful book called Recovery, the Art of Convalescence. And it's this really short, beautifully written book. And it just talks exactly, really in the context of health, right? Like recovering from a broken bone or any kind of illness, and how sometimes it's just the time that is healing. It's just the time. And we need to take time to honor ourselves and give ourselves that space and that time. And I feel like, wow, we have just lost that whole concept in healthcare. And the same thing, like one thing that I really feel like we're missing is that I just really feel that it's human beings who heal other human beings. It's not necessarily that drug or that surgery. Yes, those things are tools in the process of healing, but it is human beings. And what that means is it's the love between two human beings. It's that relationship that is actually, honestly, oftentimes healing both people simultaneously. And so if we don't allow time for that anymore, we're really, really missing the boat. And that's kind of why I'm doing what I'm doing with the business, is because like that is really the crux of it. It's about compassion. It's about understanding the person across from you, whoever that is. And how do we use that relationship, that power between two human beings, for good, for healing, for growth, like all of those things.
So, I was thinking as you were saying that about taking time. To be honest, COVID, I think, was the first time where physicians were able to just take off for being sick. Because think about, I know I've been to work sick. I'm sure you've been to work sick.
Yeah.
And you go and you might be whatever condition and you push through it. Even if you have to go to the ER in the middle of your shift, you go back, you report in, and you complete your shift. Or you go in, you lay down, you take a nap until you feel able to function at the minimal capacity, and you're on the floor taking care of other people.
Yeah.
So, for COVID, you got a diagnosis and you had to go home 5-7 days. I think that kind of woke up some people to say, okay, life is a little bit different from what I thought it could be.
And it also makes you realize like how dangerous it was, what we were doing, like pushing through, not sleeping, not, taking care of our own bodies while taking care of others. Like that's irresponsible, really, when you think about it. And now you're right. I mean, I think the COVID pandemic really taught us all huge lessons in that way. And now the oxygen mask theory, that whole thing makes just a different level of sense. Like we must take care of ourselves if we are to take good care of other people. Because what continually happens is when we push ourselves, sacrifice ourselves, martyr ourselves, that just builds resentment, fatigue, all of these things that make us not able to truly care for people in the way that they need to be cared for. So yes, I totally agree with that.
Yeah. And let's talk about dermatology and what the actual field and practice of dermatology is. We know so many misconceptions,
Yeah.
Botox, fillers, but there's so much more to the field of dermatology. So if you could just kind of give us an overview.
Yeah, so dermatology, we treat hair, skin, nails. Sometimes we use membranes. And yes, it's such a broad field that has a little bit of everything, which is why I love it. I feel so blessed. Diagnosis, treatment, surgery. Yes, there's cosmetics, laser, all that good stuff. But yeah, I mean, the bread and butter is medical dermatology, and that's what I practice, what I love. And I think one of the things that drew me to dermatology, I did not want to do it when I got into medical school. I was like, anything but that. But then, I was able to do a rotation and I was like, this is amazing. And one of the things is like people really want to come see you, which is a real blessing in healthcare. And also because what shows up on the skin is so visible to everyone else on the planet that there is no silent suffering in skin disease, I think.
True.
And so people are really motivated to get better. And it also can feel so tragic when they can't to get better. So I don't know. I feel that we're able to have a real impact. And yes, cosmetics is a part of it, but it's surely not everything. And the other thing is that, like with every specialty, the skin is like a window to what's happening on the inside. And so that's also, I think, a real beautiful thing about it. Like we can see like what might be going wrong on the inside simply by looking at someone's skin. And kind of another one of the things I'm interested to see is like, how our training has become more and more super specialized and we kind of
Right.
get stuck in our little silos or whatever. And sometimes we miss the point again about like, this is the whole person and how do we bring that back together? So that's why I think medical dermatology is so important.
Yeah, no, I agree. And I remember seeing there's so many conditions, like you mentioned, that have diabetes, have skin, hypercholesterol, have skin applications to them. And you don't really think about that until you know the whole body and able to link things together.
Yeah. Yep. Exactly.
So let's talk about you're still in clinical medicine, but how did the idea for Thimble Health come by? Just kind of talk to us about that. As healthcare providers, we spend a large portion of our lives focused on our training as well as taking care of other individuals. But I'm calling a timeout because life can change in an instant. We know it's difficult to fathom that a sudden illness, injury, or death could put you and your family in a devastating financial situation. But that's where Dr. Stephanie Pearson and her unique team of advisors at Pearson Ravitz come into play. They focus on empowering physicians like yourself to protect your most valuable asset, your income, and life's most important people, your family. So go to pearsonravitz.com to make sure that you are protected today.
Yeah. So had to solve my own problems. So I have two daughters. And when I had the first one, I was a resident in dermatology. And man, everybody probably has experienced this once, but you take someone in for their vaccines and man, she just looked at me like you betrayed me. And I
Yeah,
was
yeah,
And I felt like, man, I did. I'm a doctor and I really botched this. And it could have been so much better. It's like, what are we doing? That's what my feeling was. I was like, that was unfortunate because this could have been prevented. And so I had a lot of opportunity to fix that because there are a whole lot of vaccines that came after that. And so
right.
was able to solve my own problem in some ways because, I have a lot of friends who could prescribe me EMLA, which is a prescription numbing cream, and built the contraption so that it would be easier for her. And it was miraculous, honestly. Like every procedure after that went so much better, but it's difficult to use. Not everyone has access to that medicine. It has some side effects that people should know about. And then furthermore, one of the things I always talk about is like knowing yourself and who you are. And as a physician, I really don't like hurting other people. I am an empathic human being. I learned about myself and I used to think that was a weakness and it is not. It's just who I am. And so just treating another person's pain better also makes my job easier in all the ways. And so I then realized how huge this problem was. This is the needle aversion affects most people on the planet. It's now over 60% of adults has some level of needle fear. And we never talk about it. We never talk about it in medical school. No one ever trains us how to, do injections with more comfort for people. Like we just are at a point right now for many reasons, and it's no individual's fault or no individual group's fault, right? But we tend to dismiss the way people feel when they come in for simple shots and blood draws and things like that. We kind of just tell people, oh no, it's quick. And it's quick for us because it has to be because we don't have time anymore, but it is a huge deal for most patients. And so that's part of the mission is to let us understand what this fear is really about and the importance of fear, right? Because if someone has so much fear, what erodes? It's trust. And you can't heal, you can't have health if you are full of fear, distrust, it's just so clear to me that we must address this issue. We must regain the trust of patients if we want to utilize all the incredible advances in science and medicine that we have. So anyways, that was a long-winded answer for how it started. Basically, I think it's imperative that we really understand the pain and fear that we're putting people through, and we can make it better. So let's do it.
Yeah. So when you think about orthopedics, number one, we
Yeah.
use a lot of needles, of course, injections, but I mean, it applies to everything. I mentioned my wife's a pediatric dentist,
Mm-hmm.
giving injections all day. When you go to see a pediatrician, you have injections for medication, injections for vaccines,
Mm-hmm.
as dermatology. So it really spans across the whole healthcare. Getting IVs, you have to get a shot. So giving blood, you have to get a shot. So this applies really to everyone. But what was your focus when you started? Is it pediatrics? Is it everyone, or who does it
Yeah.
really help?
Yeah. My intention is to help actually everyone, and which I know is a difficult way to solve a problem, but I'm really intentional about not having it be kind of siphoned off into only a pediatric thing. This is not just a kid problem. I think it's very important that we start with children because that's a whole generation that we can help, but we can't ignore the adults because what's happening is they are avoiding healthcare. Like they are not getting the vaccines, they are not getting the blood draws, they're not taking their medications. And it's not their fault. They don't have the support that they need. So I don't want this to be a kid brand. I want this to solve for everyone's problem. I do think that we, as a society, tend to have a little bit more empathy towards kids and creating solutions to make their health journeys a little bit easier. So we definitely are focusing in that area. But there are other places, like, for example, people who have to inject medications at home. When you really think about that, I can't kind of believe sometimes what we ask people to do, like
Right.
IVF, all the injections that they had to give themselves. Like, how do you inject yourself on your backside? That's pretty physically hard to do. And so, yeah, I really hope that we can help everyone. And that's why everything we create can be used essentially for all ages.
One of the things I hate the most, I will give blood, but to get a finger prick is like
Yes.
the most painful thing. And I just think about a diabetic patient who has to prick their finger daily, multiple times a day, how bad that is, or what the fear or the feelings around that, you know. So definitely it's a meaningful work that you're doing for sure.
Exactly. And to do that, and I think that's the hard part. We have to put ourselves in the shoes of the patient. Like to do that, like you said, multiple times a day to inflict pain on yourself it is antithetical to being human. And so, of course, there's going to be some level of fatigue. And the other thing that, that's what we're built to do as humans. We will move away from pain. And we will also rationalize why that thing that caused us pain is bad for us, because that is what pain is. That's the function, is to teach us what is bad for us. And in the case of healthcare, almost everything we do inflicts some level of pain. And so, of course, people are going to, inch away from that or run away from that.
Right.
So,
So what's the solution that Thimble can offer?
So we are a complete platform of solutions to address needle pain and anxiety, and we treat the problem from all angles. So we treat the pain physically, we also treat the emotional and psychological side of things. So it starts with the prepare patch, and I'll just kind of show you an example of what it looks like. And it's a very thin patch that you put on. It's a drug and adhesive lidocaine patch. You put it on before any needle procedure to numb the skin so that it doesn't hurt as much.
So
And
in
then
the local area of the injection? Okay.
exactly. And by the way, if I didn't say this already, everything we make is available without a prescription because we want people to have control over their own experience, and we want prescribers to be able to provide this with ease. And so then to follow, we have the Recover patch, which is a plant-based patch, and you put it on after any needle procedure, and you leave it on for up to 48 hours. And it lessens the bruising, soreness, and ache that you tend to get afterwards. So I think for me, where it really, really helped me was post-COVID vaccine, post-flu shot, where your arm you can't use it the next day. And it's really quite miraculous for that. But I've had a lot of patients who are going through chemo infusions and, or blood donations, and the bruising really, really bothers them. And it's really remarkable for kind of speeding up the healing process there too. So that addresses the kind of physical side, but there are a lot of psychological tools that we can be using, and they're free. And so that's why we've developed an app that puts together all the research backed techniques that we can be using. So, like things like breath work, applied muscle tension, progressive muscle relaxation, cognitive behavioral therapy techniques. And we just try to put it into an easy to use tool to help get people through.
And how long has this been around?
It's new. In fact, we just launched our post-procedure patch, the Recover patch, a few months ago, and it's been kind of a soft launch. And our Prepare patch is going to be coming out at the end of the year. And so we're excited to kind of really fully launch the entire platform. The app is still in beta, so when it's ready, we will get it out to the world. And we try to have resources that kind of teach those psychological tools on our website already. We're just all about getting the information out. We want patients to know about this, healthcare people to know about this, just so we can all have just a little bit more understanding with each other. So,
yeah, there's a great need for what you're doing. Just kind of talk to us a little bit about, you knew that there was a problem, you identified the problem, and you said, hey, I can come up with a solution. But between those two things and actually getting where you are today in the midst of launching, I'm sure there's a lot of work, there's a lot of sleepless nights, there's a lot of self-doubt, a lot of different feelings and emotions. Just kind of talk to us a little bit about that.
oh my God, yes. Like the whole last week was just
Yeah.
So yes, it's been many years of ups and downs, and it's been very, very challenging personally, you know what I mean? Like on a, I don't know, on a survival level and beyond, because just like you said, I had already become a dermatologist. Why couldn't I just stay there? I don't know, in some ways, because this is very hard, but I feel like it must be done. And so when I think about, if I look back at the beginning of the journey, which started back even in 2017 when we started the R&D for the Prepare patch, and it's too daunting to think about what was going to be ahead. It's too much. And so all I should be doing, and all I could do at that moment, is just think about what is the next step. And I guess the good thing is about the human mind is that sometimes we don't let ourselves think about all of the work that needs to be done coming down the pike. And so, yeah, it was just one step at a time. Like, how do I find, the right lab who's going to help me do this work, to do the R&D? How do I, find the right manufacturer? How do I find the right people to help me? And what's amazing about it is that everything has just arisen kind of in ways that I can't even explain, right? Like the right creative director, the right product design person, the right regulatory team, like these people, these like beautiful people have just kind of arisen at exactly the right moment at every step of the way. And so this process does require a little bit of faith that if I know that this is to be, it's going to come together in ways that I'm not quite going to understand, because I honestly don't even know how we've gotten to this point. It's a miracle in its own way. And so I hope that this can really make the impact that we think it should. That what we really want to do is empower people to get all of the healthcare that they want to get. And yeah, I hope we get there.
Sure. Well, you've definitely come a long way. And I know it has to be an exciting time and a lot of fear and a lot of angst and a lot of everything going on at the same time. But that's all, getting out of your comfort zone is what I've learned.
Yeah.
That's where success is. That's where progress is. You can always do what's comfortable, but is that going to make the largest impact? Probably not.
So true. So
Yeah.
true.
So on Time Out with the Sports Doctor, this is your final timeout. So we talked about a lot, from your road to getting to Columbia, walking on, becoming captain, medical school, dermatology, on the pre-launch phase of your own business. What would be the takeaway that you could share with the audience about all these life experiences and what it's taught you about yourself?
I think two things. One, we have to shed fear. It's always going to keep coming back. And the fear is telling you that it's keeping you safe, and it is not. It's holding you back. And so at each moment, we have to shed the fear and put ourselves out there. And I didn't make this up, but I recently watching something. Oh, yes, it was a 103-year-old woman, and someone was asking her, look, what is her secret to life? And she said something to the effect of reach out for life, meaning stretch yourself, challenge yourself, but then also let go of craving the outcome you desire. And she didn't say it in exactly those words, but that's what I took away. And I think there's a lot of truth to that. We do have to reach and strive, and that, because that's what we're built for. That's what we humans, that's what we all do. You see a mountain, you're just going to want to climb it. Like that's just
Yeah.
It's in us. But at the same time, it doesn't have to be about that endpoint, like you were saying earlier. It is about the journey and enjoying the journey, and we have to enjoy it, and we have to know that it's going to end the way it's supposed to end. I think that's it. I think we have to enjoy this time that we have and keep making strides towards what is hopefully good for the world, good for yourself and good for the world.
Sure, sure. So another, I was part of a talk recently, and it was talking about which one is more important, the process or the destination, or the journey or the destination. And I can't remember the exact animal, but it had a turtle riding on another animal's back.
Mm.
And it said in the end, it was the companionship that was the most important. It was
Yes.
met along the way. It was the relationships you built. And, just thinking about, like you said, everything just seemed to happen. You meet this person, you meet this lab. And now, even if we feel that it's going to be a success, but if not, you have all these relationships that you can take to the next project, to the next thing. So I think that's all part of it as well. That's a big part of the process is, when I launched this podcast 3 years ago, did I ever imagine that I could talk to Dr. Dawkins, on a Monday afternoon about Thimble Health? Absolutely not, because who knew? Our worlds are completely apart, and here we are. So, I think that's a beautiful part of it.
Oh, I love that so much. I love that. So I think you're exactly right. I think I've been thinking about that actually a lot. Like, it's not about the outcome. Who cares what happens in the end? It is about the relationships and how we treat people and all of that. I love that so much. I'm going to have images seared in my mind. Thank you.
Got it. Well, all right. So tell everyone how they can follow you, how they can kind of keep along with the process of what's going on with Thimble Health.
Yes, please visit our website at thimblehealth.com. Thank you.
Okay.
And we have lots of guides and tips and tricks for people of all ages. You can also purchase the Recover Patch. And then if you're interested in providing it to patients at your site, in your hospital, in your clinic, in your pharmacy, definitely reach out. We sell wholesale. We have distribution partners. What I realize about these things, and for anything that we really want to change on a big level, it has to start at the grassroots. Like, we have to, on the ground, ask for these solutions and let people know that this is what we need. And that's when change happens. So all of that matters. Also follow us on Instagram at thimble.health. We also started TikTok. That's another one of my fears. I had to get past social media. Yikes. But we're doing it. So please reach out, and email us anytime if you have any thoughts that you'd love to share. We have a blog that we want to share everyone's stories about how you deal with needle procedures, either as a patient, as a clinician, as a caregiver. So please share with us at team@thimblehealth.com.
Perfect. And we will include all that information in the show notes. Thank you again for your time. And we're looking forward and we're cheering for you on the podcast.
Thank you so much. Thank you for this platform and for inspiring all the people that you reach.
Please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.